So welcome everyone to our webinar today on bullying at any age is not okay, practical steps and a tool guide to reduce bullying between older adults. I'm so pleased to be co-hosting this webinar with my colleague from the Canadian Network for the Prevention of Elder Abuse and our speakers from Sheridan College from the Centre for Elder Research. Today is also Pink Shirt Day. So as you can see, many of us are wearing pink today. This is a significant day. It started off as a initial initiative, I guess, from school-age children in Nova Scotia about treating people with kindness and stopping bullying behavior. And it's kind of grown to all different ages and to encourage people to not bully one another, to stand up and be kind. So this day is in recognition of that. And so often we forget about older adults in bullying when we think about our age groups around who can be bullied. Before we get our presentation, I would like to give our land acknowledgement as we start. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship and land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. A few housekeeping items to go through before we begin. As you know, everyone will be muted during the webinar, except for our speakers. The speakers will be visible when they're presenting, and also during the question and answer period. Both Benedict and I will be off screen during the presentation. As I mentioned, we do have our ASL interpreters with us today. You can, again, view them in gallery view or pin the individuals that are ASL interpreters that you see as a title in their screen. So they are always visible for you. Or you can make their images larger by dragging the frame to the left of your screen to make the images bigger. Just encourage you, if you have any questions or comments or just want to give a shout out, you can please post those in the chat box. If you have a specific question for our speakers or for any of our, for myself or for Benedict from CNPEA, please post those in the question and answer box. And we want to make sure that we don't miss your questions. That's why we ask you to put them there, because if we do get a lot of chat conversations, sometimes they get missed. So we may redirect you if you forget to post them there. So just as a reminder, as you know, we are recording today's session. It will be up on our website within the next couple of days, both CNPEA and EAPO site, and probably Sheridan College as well will have access to post this as well. We also encourage you to complete a short evaluation after the presentation today. There'll be a pop-up email as well as an email follow-up that will be sent out with a link if you didn't get a chance to finish the survey today. We do appreciate your feedback. It helps us guide future webinars and gives us direction about things that we can, other topics of interest to you and things that we can do to improve future sessions. And lastly, I just wanted to point out, we do respect everyone's privacy and confidentiality. This is a public forum. So if you do have a personal circumstance or situation that you want to address, we do encourage you to contact us directly through our website or a phone or to CNPEA website to ask our individual questions about a situation. You can ask general questions posed through the Q&A box. We're more than happy to do that. It's just we don't want people disclosing personal names of maybe someone that they have concerns about, just in terms of respecting people's confidentiality in that conversation. For those who are just joining us for the first time, Elder Abuse Prevention Ontario is a nonprofit organization. Our goal and mission is to make sure seniors are free from abuse, have a strong voice, feel safe and respected. And our organization's over 20 years old. We have continued with our mission around raising awareness, training and education. We work with many organizations, both locally, regionally, nationally, even cross borders. to assist the coordination and advocacy for the rights of older adults, to ensure that we can work towards eliminating and preventing abuse from happening to all older adults. We are mandated to implement Ontario's strategy to combat elder abuse through the Ontario Ministry for Seniors and Accessibility. The strategy was implemented in 2003. These three main pillars of the strategy have not changed, as you see here, but the work that we do under each of those pillars has expanded tremendously since we started the strategy. So we do a lot of public education and awareness. World Elder Abuse Awareness Day is an upcoming event in June. Both CNPEA and EAPO, as well as our partners with CanAge and BCCRN in British Columbia, are working towards developing a campaign for everyone to use this coming June. So be on the watch for that. We do a lot of training for frontline staff, those working with seniors or vulnerable adults, to inform them how to recognize signs and intervene in situations of abuse. And as I say, we work with our coordinated communities, our elder abuse networks within Ontario, to strengthen our response and information sharing around the abuse prevention. I'm going to ask my colleague Benedict to describe the Canadian network for the prevention of elder abuse.
Thank you, Ryan. So I'll try to speak louder this time. I am the Executive Director of the CNPEA, Canadian Network for the Prevention of Elder Abuse. We are a pan-Canadian organization, a charity, and our mission is to connect people in organization and foster the exchange of reliable information around elder abuse prevention, around ageism, the goal being to help people stay safe and keep each other safe through community-based resources that have been tried, tested, and recommended. We're also working to help advance program and policy development on the in issues related to the prevention of elder abuse across the country. So we have a large network of supporters and partners, which includes provincial and territorial elder abuse networks, one of them being EAPO, and we're very happy to partner with EAPO today for this webinar on bullying. So thank you all very much for being here, and we look forward to your questions in the Q&A box.
Thanks, Benedict. So it gives me great pleasure to introduce our speakers today. Kirsten Madsen, who is the chair and research ethics board on the research and ethics board for Sheridan College. She's also a faculty member. We've worked together, I guess, on this project for 4 years or more around bullying, and continue to work in partnership with Sheridan College. Kirsten has a PhD in developmental psychology from the University of Sheffield in England. And she graduated, her graduate work was related to anti-bullying projects. So she's got a lot of knowledge and experience in this field. She's also done research on training with frontline staff in areas of bullying, aggression, age differences, gender differences, and program development. And she was the, as I say, the project director for our first phase of this project around seniors bullying seniors, what is happening in Ontario, where Elder Abuse Prevention Ontario was a partner in that project. So we're very pleased to have you with us today. And with her, we are joined by Lisa Francis, who's a research manager from Sheridan College as well. And Lisa is an older adult advocate that's worked with diverse older adults and communities in Toronto. Her background ranges from working in long-term care, retirement, adult day programs, and managing a multicultural seniors active living center in North York. She also was the lead manager for the Senior Bullying Project and took a lead in developing the anti-bullying toolkit, which you all will have access to. And after this presentation, you'll be downloading it right away. And she's a graduate from George Brown College in Activation, Coordination, and Gerontology program. So welcome both of you to our session today. I know everyone's going to learn a lot from you, so I'm going to turn it over to both of you to begin the presentation.
So thank you, Rayanne. And today, Lisa Francis and I will be discussing what has been happening with the Seniors Anti-Bullying Project. This was a project began in 2018 as a partnership when the then director of the Centre for Elder Research at Sheridan, Pat Spadafora, Elder Abuse Prevention Ontario, and myself came together to develop this particular project. Further, I'm very proud to say that you'll see in one of the logos is the Bob Rumble Centre for Canadian Excellence for the Deaf Community. They are now, so the second phase of the project includes this partner as well. The first phase of this project was funded by the Social Sciences and Humanities Research Council, and the second phase is being funded by NSERC, so the Natural Sciences and Engineering Council of Canada. Today, what we're going to be covering is, so we're going to be briefly talking about the results from the large-scale survey conducted on bullying between older adults, specifically in Ontario. We're going to be talking about the toolkit and that involves anti-bullying strategies, how it was developed from these results. And in fact, many of you may have been at the launch of that toolkit, which took place on March 13th, 2020. Well, we all know what happened then. And since then, the toolkit has been made available to the public free of charge. And I'll be talking about some of the downloads. And I will also be talking about the next phase of the project. Lisa is going to give you some details with regard to the toolkit itself and the specific sections. But before we begin, we have to talk what senior bullying actually is and differentiate it from elder abuse. So bullying is sometimes called harassment and happens when someone hurts, intimidates, or scares a peer consciously or unconsciously. And we include the unconsciously because sometimes people will say, this is the way I have always behaved. It's when someone is being bullied, they often have a hard time defending themselves. Bullying is usually not a one-off event. It can happen over and over again. Now, this particular survey and the project itself relates to bullying, which is based on peer-to-peer interactions, and not perpetuated by a person who is in a position of trust. And we say this so that it differentiates from elder abuse. There are protocols in place with regard to disclosure of people who are in a position of trust, and I would refer back to Rayanne with regard to that. But the focus here is on peer-to-peer bullying between older adults. Overall, the aims and the objectives of this particular project was that we began with a large-scale survey of older adults in Ontario on their experiences with bullying. Once we collected the data, the next phase was to use this data. We were able to develop and create a toolkit designed to support the implementation of anti-bullying initiatives with older adults. Further, the next phase, which we're entering into now, is also an overall objective, and that's to implement, evaluate, improve, and build upon the evidence-based policies and resources. From a historical perspective, what happened? So in our phase one was the survey itself. So the results from the survey were used during four full-day interactive workshops designed to solicit formal feedback from stakeholders. Using the survey data, feedback from the workshops, and best practice from evidence-based anti-bullying practice with other populations, we were able to create a toolkit designed to support the implementation of anti-bullying initiatives with older adults. The second phase is the Senior Anti-Bullying Project that incorporates implementing the specific strategies. Now here you can see that's up is the survey results from the first survey. So the large scale survey involved 683 participants, And what's really important is that it was quite evident that in fact, bullying does occur between older adults. That said, it manifests itself in a different way. And as such, why we've developed a toolkit that is age appropriate. But if we look at the results, we see that in the last 4 months, 57% of those that responded to the survey said that they'd been bullied. 56% engaged in bullying behaviors, and 55% witnessed bullying behaviors themselves. And you'll notice as well, what's really important is that out of those people who reported that they engaged in bullying behavior, 70% of them said that when they engaged in this behavior, it was actually upsetting or extremely upsetting for them. So it's really clear with regard to the fact that the behavior they're engaging in is not something that they actually want to be engaging in. So part of our strategies we knew had to be to implement different strategies for alternative behaviors. Now, engaging in bullying behaviors was upsetting or extremely upsetting. And witnessing bullying, oh, sorry, correction. It was those people who had actually engaged in it, 78% said they were upset or extremely upset. 70% who had been bullied said that they were upset or extremely upset. Now, witnessing bullying, so for those 55% of respondents who said that they had seen it, 45% of them said that it made them very angry. And 18% worried that in fact it would happen to them. So this sends a clear message that bullying behavior between older adults is something that's happening and it needs to be addressed. As such, we've got the toolkit, and the toolkit aims are to prevent and target bullying behavior between older adults. It includes strategies and activities. And as I had said earlier, it's evidence-based. So it's based on survey results and stakeholder feedback and existing best practice with previous bullying projects. The intended audience for the toolkit itself is the senior leadership team. So from the specific organizations themselves. It also is targeted to staff and volunteers from the senior residences and organizations and clients. Another thing that's also quite important is there are specific instructions that are being given to whomever at an organization is coordinating and facilitating so that it can be implemented without the help of the research team. Now, if we could go on to the toolkit.
Thank you, Kirsten. So I'm going to talk about the different sections of the toolkit and what you will see within it. Just as an FYI, I've actually posted our project website as well as the link to the toolkit itself, where you can download it for free yourselves today, after today, anytime. It's linked to the Sheridan source website. So module 1 is about policy and procedure. So the way we see module 1, it's really the anchor of the whole toolkit. Other bullying implementation projects in the past have found that the key strategy for reducing bullying behaviors is a clear policy and procedure specific to bullying that is developed by the organization itself with as many stakeholders as possible. So creating a policy and procedure is a strategy that has been proven effective in reducing bullying behaviors in other populations. So policy, there is going to be a policy statement that defines why this policy is being developed, as well as who the policy applies to. And in regards to a procedure, it clearly outlines the actions and steps needed to meet the goals of the policy. This then includes clear instructions for reporting that align with your individual organizations. There are suggestions for these in the toolkits, such as reporting. And this was clearly asked for in the survey. We asked the older adults themselves, how would you like to report bullying behaviors if they are happening to you or to someone if you see it, if you witness it. So there are some suggestions within the toolkit for those things. And finally, these policies and procedures need to be alive and updated. So they need to be living documents that are frequently updated and are not, put in a binder and collecting dust somewhere in someone's office. So it's something that will definitely need some kind of review, whether it's biannually or annually. That would be up to the individual organization. Module 2 is discussion and education. So the aim for this module is awareness raising. The activities included in the discussion and education module are useful as an introduction into any of the other modules within the toolkit. So it's composed of 2 activities. So one is called Is It Bullying? This gives the communities a chance to go through scenarios as a group and determine if scenarios are bullying. And if not, they will determine what type of behavior it can be classified as. Groups will explore bullying, elder abuse, challenging behaviors, non-bullying behavior, and criminal activity, and the differences between those. In activity 2, there is a series of case studies that take place in various different community settings. This module is meant to begin generating discussions and inform the people engaging with this toolkit on bullying how to recognize or differentiate differing bullying behaviors. In Module 3, Response Training, it contains strategies and activities for addressing bullying behaviors. This module is broken down into 3 separate sections. Those who are targets of bullying behaviors. So these people will have a clear avenue to support themselves and help stop bullying behavior from happening. The second section is alternatives to bullying behaviors. So we know from the survey that 56% of people who reported that they engaged in bullying behavior, that 70% of them felt it was upsetting and extremely upsetting. So people are clearly resorting to bullying to get what they need. And what this section does is provide them with alternative behaviors to address these needs. And the third section is about the witnesses and how they can become allies. What is clear from previous research on bullying is if people see bullying and don't say or do something, then they are sending the message that they support bullying behavior. In addition, witnesses to bullying can become great allies in supporting those who are experiencing bullying behaviors. So they can learn some of those strategies within the toolkit. Facilitators who are working through the toolkit, there are clear instructions, activities, and prompts for them within each activity. Participants can receive the activities, whether you choose to print out copies for them or, project it onto a screen. And some of the other activities within this module are journaling, role playing, and eco mapping. And then module 4, creating a positive environment. So this module aims to help older adults see the benefits of shared living or shared spaces through activities that promote the creation of positive environments for all. This module includes a list of suggested activities and resources that each organization can, again, tailor to their older adult clients' needs and interests. Activities include hosting an Act of Kindness Day or a Get to Know Your Neighbor activity. And some of the resources also include videos that you can share within the groups or within staff. The next section of the toolkit is templates. So what you will find in this section are various templates that you can use when starting your anti-bullying initiative. These templates are meant to be just that, guides. Included is a guide for a comfort agreement. This is an alternative to what some of you might know or call a code of conduct, an incident report form, a template for a policy, a template for a procedure, and 2 examples of posters that can be tailored or changed to be used within a facility. If you already have these in place at your organization, then you can use these as a way to see if there can be any updates or changes made to your existing organizational documents. So this is a good time to sort of check in and see where are you at as an organization with the potential policy and procedure you already have in place, or how and where do we want to start with a policy and procedure? You'll get sort of a great starting point in this section of the toolkit. Next section under the toolkit is resources. So all of the suggested resources included are meant to assist older adults further who are experiencing bullying behavior. The resources were divided into 5 categories: safety, legal, housing, community supports, and general resources. All the resources were called and vetted prior to the publication of the toolkit in 2020. Therefore, there might be some changes to some of the resources listed, but we will be incorporating those in the updates of the toolkit in this now second phase of the project. And we also just wanted to ensure that the resources provided would not only be useful, but accessible for the older adults themselves. Finally, free training resources is the last section of the toolkit. So additional suggested free resources are meant for facilitators and any other staff involved within the organization. One of the resources that we list is a diversity training course, and it also offers a printable certificate for those who complete the training. So this could be a way to pitch to your staff, something else to add into their files as, you know, a benefit and added training that they've completed. And these resources, if completed, may also be able to further assist in the overall facilitation of the toolkit. I'm going to turn it back over to Kirsten now.
So thank you, Lisa. As I had said, that on March 13th of 2020, we actually launched the toolkit itself, and it was hosted by Elder Abuse Prevention Ontario, and Rayanne hosted it. And since then, the next phase of the project is that we're going to be taking the toolkit itself and going to 8 different implementation sites, so 8 different residences, and rolling out the toolkit and evaluating it. So given the delay in the implementation due to the pandemic, we've made the toolkit available before the formal evaluation is actually taking place. So we wanted to make it available to the public. In the next slide will actually be, because I could see that in the chat room, all of a sudden things were lighting up, but that's in a later slide, is the exact source where you can get it. If we go back to the previous slide with regard to the downloads themselves, so this particular toolkit is available. And by February 8th of this year, we've already had 438 downloads. So that's really encouraging that people are trying to make efforts in order to prevent bullying behavior happening between older adults, and that there's clearly is an interest with regard to it. Now, in the next slide, you can see where you can actually download the toolkit. So the toolkit can be downloaded through the Sheridan Source webpage. Please note that the project and the toolkit migrated from the Sheridan Elder Research Centre to Sheridan Source. Further, it's also available on Elder Abuse Prevention Ontario's website, and they have a new website with the updated toolkit there as well. So either location, you can get the full toolkit. Now, going on to the next steps, because we have this toolkit in place, and it is based on research data, feedback from the different organizations that were there at the 4 interactive workshops, and then best practices with previous populations in the area of bullying. So the next phase is the implementation and evaluation of the toolkit itself. So as I had said, we got funding from NSERC, and we have until April of 2025 to roll out the project into 8 specific sites to evaluate it and provide a report, and also update the toolkit. Now, I'm very happy to say that in this new phase of the project, the Bob Rumble Centre for Canadian Excellence with the Deaf Community is also involved, and they are currently in the process of developing and filming ASL videos to accompany the toolkit. And it's key with Bob Rumble as a partner and an implementation site that the inclusion of resources for the deaf community couldn't just be a tag on. It was really important that it was an integral part of the whole project, the second phase of the project itself. And such, it's central to the project. And these videos, once they're finished, will be available through the different partner websites for the use of everyone as well. Now, as I said, in this phase, we're going to be implementing the toolkit in 8 Ontario websites. Bob Rumble being one of them, Richview being one of them. Abbeyfield has various sites that are also going to be involved, Harmer House in Ottawa, and Community Engagement Middlesex Housing Corporation in London. So those are the 8 sites where we're actually going to be implementing the toolkit itself. And once we've done this, we're going to be learning from the implementation sites exactly what is effective and how to update the toolkit itself. Each one of these sites will be engaging in a survey to begin with on the nature and prevalence of bullying at their particular site. Not only will that act as a way of knowing about what was happening beforehand to see if the toolkit was effective, but it also allows the different sites to have a better understanding of exactly what's happening. Because in fact, what's required to be implemented from the toolkit is in fact the policy and procedure, because previous research into bullying has shown that developing your own policy and procedure on anti-bullying is key to reductions in bullying. Then each one of the sites can choose which strategies they wish to engage in. Our team is going to be supporting those particular 8 sites in order to implement those strategies. And then at the end, there's going to be an evaluation. So a post survey to see if in fact bullying has been reduced because of these strategies, and also how can it be improved. So we're going to be revising and updating the toolkit by April of 2025. Now, what can people do who aren't part of the 8 different sites? If you download our toolkit and you use it, we would love it if you provide us with feedback with regard to how it's going. And also, if you want to think about translating the toolkit, we're building on it, because the whole idea is all this research was done not to hoard it, but to actually share so that people can work with these resources in order to target bullying behavior between older adults, so that they're not just using something from a different population that's not developmentally appropriate. So you might want to think about language translation or other ways of doing it. But I do need to state that in fact, the intellectual property rights are for the 3 partners. So the Sheridan Centre for Elder Research and the authors involved in the toolkit themselves, also Elder Abuse Prevention Ontario, and Bob Rumble will have the intellectual property rights for the videos themselves. So it's a matter of, but it's not that you don't use them, you just actually acknowledge what you're actually doing, acknowledge the project itself, and let us know how you're doing so that it can be available for other people as well. So another thing that people can think about is how the tool can be used and adapted to the groups of the older adults that you work with. Because we've already had conversations around how different strategies that we have in the toolkit can be modified for different Indigenous groups, in different languages, things that are more culturally appropriate for the different groups that people are in fact working with. So that's one of the things that people may want to build upon. But again, as I'd said, if you will be building upon it and sharing that creation, that you still acknowledge the intellectual property of the seniors project itself, and let us know how you're using it so that we can also share it. This is one of the absolute beauties of Elder Abuse Prevention Ontario and the Canadian Network for the prevention of elder abuse, that they are superstars when it comes to disseminating stuff out. So we are really fortunate that this particular partnership has grown because it allows for that academic rigor, but also enables for the sharing that's taking place. And now, as I had said, we also have Bob Rumble on board as a partner, so that's incredibly exciting too. If you have any specific questions that you wish to direct to the Seniors Bullying Project and you didn't want to put it in the Q&A, because the chat, you could see that my eyes were widening up. As I was trying to go through the PowerPoints, I kept getting things like floating up on the chat. So that was a bit disconcerting. So if we were wondering if there was something the matter with my eyes, that's what was happening. So if you have specific questions and you don't want to include it in the Q&A, they can be directed to myself. I'm the lead investigator on the project. So my email address is coming up in the next slide. There it is. So there's my email address that you can email me directly. Also, Lisa Francis, who is the research manager on the project, that's her direct email address. And you can see that from a Sheridan perspective, on the Sheridan website, this is where all the updates go with regard to the project, including the toolkit and any other webinars or any other dissemination of information with regard to papers. Currently, we're writing a paper on the survey results, and this will be uploaded in there. So I'm going to hand it over to Lisa if she had any closing statement she wanted to make.
Thanks, Kirsten. So yeah, just one small note that I wanted to let everybody know, just like Kirsten mentioned, once you go through the toolkit, right at the end, there is actually a link for a survey in SurveyMonkey, where you can just let us know how your experience was with the toolkit itself. So if you want to do it a little more in an anonymous manner, you're welcome to do so. But I do urge you to reach out to us directly, because we want to know how's it going. You know, are there sections that worked really well, sections that maybe could have used a little bit of a tweak, or maybe you made a change to those sections that worked really well for your group. So I just really encourage everybody to stay in touch with us. Just on a small personal note, I know some of you on the webinar, I can see, you know, I've been on the project since 2018. I've been here since the beginning, but I will be taking a little bit of time off as I'm starting my family. So if I'm not here, you're like, where did Lisa go? That's why. But I'm very excited to come back next year and reconnect with the project, reconnect with all the host sites, and as well as all of you. So again, please feel free to reach out to Kirsten or myself. And we really look forward to seeing those downloads go up after today's webinar. Like I mentioned, it's absolutely free to download. You can download as many times as you need. The way that the toolkit was created is that when you print it, it's a really accessible format in terms of people who might have visual impairments. The one small suggestion is that we ask that you not print on glossy paper, just because that makes it tougher for anybody to read. But you'll see those notes in the toolkit itself. And I see we have quite a bit of time, but I saw a ton of questions coming in. So I'll hand it back over to Rayanne and see what questions we can answer today. So thank you so much, everybody.
Great.
Thank you,
so
Lisa.
much. So I'm just going to stop share screen so everyone can see our speakers and you can go through the questions, Benedict.
Sure. And as you said, we did get a lot of questions and a lot of interest while you were speaking. So I've been trying to do my best to collect them all, and hopefully we have time to go through all of them. So the first one that came in was inquiring about condo communities. There are more and more older adults moving to condos, and this is a new environment where situations of bullying can arise, but is not necessarily always addressed. Is this something that is addressed in the toolkit, or do you see potential for providing some kind of training in that environment?
So this particular toolkit was created so that it could be used not just in seniors' residences, but also in any community of older adults. In fact, Abbeyfield is, if those of you who aren't familiar with it, it isn't a traditional seniors residence. So that was amazing to have them come on board with regard to it. They're more like housemates. So it will be very interesting to see how it works with regard to this population and how we may change the toolkit to address any unique issues that they might have. Now, also another one of the communities is the Community Engagement in Middlesex Housing Corporation as well. That reflects more of a condo type seniors living, which as they've already pointed out, they have certain issues that may be different from others. The idea that people may say, well, I'm paying rent, so I can behave in the way I want. So this is part of the reason why it's really, really important that there is this positive environment that's created. The idea that to make everybody's experience of where they're living much better. And again, for those who are involved in condo living, what's really, really pertinent is that whole idea that so many people that said they were engaged in bullying behavior it was actually really, really upsetting for them. So clearly they don't want to behave in this way. So I could really see how there may be those type of strategies and workshops could be set up in a condo setting where people would want to start to think of alternatives for how to actually be able to meet the needs that aren't being met, that they're behaving this way. One of the key things too that we didn't bring up in this particular webinar that is so essential is you'll notice we never use the terminology bully, victim. We never talked about it in that way. Instead, it's people who are in fact engaging in bullying behaviors and those that are actually the target of these behaviors. So you can see how this toolkit can be more inclusive, and it can also be used in specific community centers and various other places. Like you can really see how these different strategies can be adapted right across the board, because there are specific, as Lisa had said, there are specific activities in there that people could actually use just on a one-off, or if they wanted to create their own workshop day.
Great, thank you. Before we dig deeper into the actual toolkit conversation, we've had questions about whether the toolkit is available in a printed format for people who cannot print it at home or at the library. And we've also had questions about languages. Is the toolkit available in French, or will there be, plans to develop it in different languages in the future?
So the survey itself, the original survey itself was available in French, Spanish, Punjabi, Portuguese, Italian, and Simple Chinese. So those were identified by the Ontario government as the top languages that were spoken with the 55 plus population. The numbers were so low with regard to who responded that we wouldn't be able to get the Ontario funders to develop that portion. So this is focusing in on here. For example, only 13 of our surveys were completed in French. Now, from our colleague, our Francophone colleagues, it's become clear why this happened. And also from our Punjabi colleagues as well, was that oftentimes if things are translated into a different language, it's just easier to go to the first language. So people completed it in what wasn't their first language as opposed to go to the translation. That said, NSERC is funding the evaluation and implementation and evaluation of this particular toolkit. What they want to know is pre-post, they want to see the efficacy of the strategies. So therefore, we're reaching out to other people, as you saw in the second last slide, if there are organizations who would be willing to take it on, to publish it in a different language, to make it more available for more and more people across Canada. then that would be so welcome and so appreciated, because there's only so much that our project can do. So in an ideal world, we're going to start to build out. Hence, that's how the Bob Rumble Center came into place, even during our think tank. So Rayanne will remember during our think tanks, she came along like such a trooper to all of them. And it was really important to get people engaged and to get people interested and to think how we could get this to grow. So again, I know I'm being the cheerleader, but if there are people out there, go for it. Please go for it.
Thank you. We've had two questions come in inquiring about whether the toolkit takes into consideration those who have either acquired brain injury or mental health that might be declining, maybe early signs of dementia, and how older adults, how to manage that challenge in terms of recognizing what is potentially a personality disorder versus just not being a good co-living person.
This is such an important issue. And from a research perspective, from our survey, we had the exclusionary criteria was in fact dementia and cognitive impairment, because we really had to, in order that it be truly evidence-based, we really had to hone in. And even then, if there was anybody who'd seen the survey, you could see it was 22 pages long. It was not a walk in the park. So we are so impressed that 683 people actually completed the entire survey. That says a lot. So in the toolkit itself, it's specifically, we didn't have the data to be able to translate it for those populations. But that said, there are some examples in the discussion and education piece that raise the issue of different mental health issues and cognitive impairments and how that would differentiate from bullying that didn't involve that, so that people will actually start that conversation. But with regard to if somebody's alluding to aggressive behavior amongst those suffering from Alzheimer's, this toolkit doesn't target that.
Thank you. We still have a few more minutes, which is, I'm glad, because we have more more questions coming in for you. I think people are really interested in this topic. One person was asking, what do you do as an individual, witnessing a situation, if you feel that the organization or the senior staff that should be stepping in is either minimizing or ignoring a situation of bullying?
Oh, that's a very, very good one. Now, from an organizational perspective, I'm going to do a quickie on that one. I'm sidetracking, but really they may not legally be required to do something when we talk about peer-to-peer bullying behavior, because it doesn't go into the criminal activity. But morally and ethically, it's so important to try to do something, to make avenues available for people to be able to report bullying behavior. Because one of the big things that came with regard to the people who had witnessed bullying was that they said they were scared that it would happen to them. They were scared of reprisals. So what became really important is that different agencies and organizations set up anonymous ways people can actually report bullying behavior, and that they have avenues for communication. Now, going back to the specific question itself, if a person themselves sees bullying, it's a really interesting thing from psychology, the idea that if one person speaks out against it, there's a strong likelihood that there's a lot of other people that are thinking that that behavior is inappropriate as well, but they're just staying quiet because they're not sure how inappropriate that behavior is, how negative that behavior is. In fact, do those people have a relationship that involves this type of banter or this type of behavior? But in fact, if it's seen, it's making somebody feel uncomfortable, then they need to speak up and say, you know, this behavior isn't very comfortable. It's making me upset. That's one way of doing it. If it's something that's ongoing, we've had a lot of, just as part and parcel of the project itself, I've ended up getting a lot of emails from people sharing specific examples of things that have been happening to them. So if something in a situation where being damaged as a way to hurt them, if in fact they don't feel comfortable because they don't feel safe confronting the person who's engaging it, then that's where it's important to actually go to whomever is running the organization or managing the organization to speak to them. But by doing that, it's clearly sending a message. I'm seeing this. I don't think this is okay, and we need to do something to do it. But we always have to also think in terms of how the witness to the bullying is also feeling and their comfort and safety levels, because that says something about the organization if they don't feel safe in speaking out, or if this behavior has come to the point where it becomes normalized as well. And again, it's not, you know, one of the things that from a developmental perspective, this is not your schoolyard type bullying. It's demeaning to say that it's just the mean girls coming back, because really, these are people who have had a lot of life experience. These are people who have perhaps engaged in this type of behavior as a way of doing things, and they don't know how to engage differently. And they've become very, very good at it because it was an effective strategy to employ. So all those things need to be factored in and considered when, in fact, we're targeting bullying between older adults.
Kristen, there was just a comment too about asking if bullying was related to ageism and what your thoughts are on that.
So ageism and bullying are two different things. You can get, when we're talking about bullying between older adults, we also did find bullying one age group, because older adults is a huge group, right? It's in our particular study, we were looking at 55 plus. So the range is incredible. And we did find, in fact, that people were being bullied because they were younger, older adults. So others felt uncomfortable with them. Then you also had older adults who were being bullied by younger adults because they weren't as fast or they weren't engaging in the behaviors as quickly. So that's why Christina just popped up. Education is key. Oh yes, education is key with regard to communication and education and an understanding of the other, the idea of another. Now, there's more to it than just say, you know, I also am cognizant of the intricacy of ageism, that there's a lot more than just, you know, bullying behavior with regard to ageism accompanies so many things, as we've all been witnessed during this pandemic, and how heartbreaking certain things in certain language has been with regard to the general population, to older adults, younger adults, all the different age groups, the way they interact and behave each other. But it's also one of the things on a positive note, because I always tend to be a bit of a cheerleader, is the idea it's also heartwarming that groups that may not necessarily had thought about what they could do to help older adults and to protect older adults from the virus have also been thinking in terms of that. So I just wanted to add that as a side note so that it doesn't come across as completely glum and sad. But the fact that there is, between different age groups, you do see a support system. So I know I've gone around it in a very long-winded way, but it's the idea that, yes, there is ageism as a component of bullying, but when we're talking about peer-to-peer bullying, we're talking within that 55 plus group. And then there is bullying that happens from younger adults and organizations and groups to older adults that is bullying. Because bullying is a way of engaging in a behavior that controls another person's behavior. Getting a person to do what you want in a very coercive and hurtful manner. So that also adds more to the language of what bullying is. We have a very simplistic definition and we use it in a sort of a roadshow type of a way so people can get a clear understanding of differentiating it between bullying and elder abuse, and then it is peer-to-peer, but there's a lot to it.
Thank you. We have, I'm going to ask you 2 more questions because we're running out of time, but there's so many good ones. Somebody was inquiring about cultural sensitivities. Are they taken into consideration in the toolkit?
I could see Lisa nodding, so she wants to say something. You go for it.
Yeah, we really try to focus on, especially when you look at the various scenarios and the case studies and the role-playing activities within the toolkit. We really try to, keep in mind the various locations that bullying behavior can occur, the different types of people, whether there's cultural innuendos, gender differences and some stereotyping and why things are coming up. So we really hope that, we tried very hard to be as culturally sensitive as we can. And also, using some of the feedback we received from the surveys themselves and adapting some of the situations we heard about in the think tank. So we hope you see that coming through.
Great, thank you. And then last one for the road, because we're getting there. You have a colleague that's a postdoctoral fellow at the research chair on mistreatment of older adults at the University of Sherbrooke. They had they had many questions about the project, the sustainability of it, all the things, but maybe those questions are better addressed by email between all of you. But one question that stood out was—
Can I just bring it up just for them?
Sure.
We are so sad that KEG was online this year because we were so desperate to connect with you guys. So please email us. Okay, I'll be quiet now.
Well, and the last question for you from that same fellow was, do you plan on creating a training program? And from somebody else to follow up, if there is a training program, how do you join to become a facilitator?
So right at this particular point, we're not even thinking in terms of that particular. Right now, we are still at the stage. So in an ideal world, yes, what I could envision that we will actually have a hub whereby it will be an extension of bullying amongst older adults, very similar. So we've done work with PrevNet as well. So PrevNet is an anti-bullying initiative also, so that the bullying community is quite well connected. We're very pro-social and talking to each other and sharing resources and sharing data that comes in. And other ones have, in fact, created these different avenues for where people can get information on how to connect with a trainer. But really, that's beyond the purview of this particular, where we are at. Right now, we're at the implementation and evaluation of the project. There are the 8 identified sites. We're going to continue to update the website with regard to providing information as it comes in. And also information with regard to as the toolkit grows and expands. But it is very academic at this particular time. So no, there isn't a training machine yet. And we may never get to that point. But who knows? Somebody
You never
somebody.
know. Some partners might arise from this webinar today. Thank you so much for taking all these questions, and thank you for being so passionate in the chat box and the Q&A box. Rayanne?
Yeah, thank you so much for all those great questions, as Benedict mentioned. Some people were asking about resources as well in the chat box. So we would encourage people to reach out to the Senior Safety Line, which is run by the Assaulted Women's Helpline. And that number's you see on your screen, 1-866-299-1011. They can provide information and resources within your local community. You can actually ask for help online if you're using a computer, and it's available in over 200 languages. So they can provide support, information, and referral. We, as mentioned, I think, Chris, at the beginning, you can go to our website. It has a new face and new look, where you can find this. This project is under our projects page, and you'll see a picture of the toolkit where you can download that and also view past webinars. And we have an infographic that CNPEA has adapted from Agent Opportunity and CNPEA. So we've adapted for Ontario with some resources in there. So you'll find that on our website as well. This is the fact sheet that you will find. It will be posted along with a PowerPoint for you to access. And it has on the back a listing of the resources that are available. Not only just a few, obviously space is an issue, but we also have a directory that we've printed that also has a listing of provincial organizations that you could reach out to for assistance. It's broken down by issues that you might need, such as government services or legal supports, those kind of services. Benedict and I have been, Benedict had mentioned that the CNPEA is taking a lead in developing a national strategy, and we have developed a number of resources, and they're launching soon. I'll let Benedict speak to that, a strategy. But we did do a video, so you'll also find on our website a video around ageism and how we need to treat each other with respect and dignity, not bullying each other, you know, because we're all looking at our future selves and making sure that we live in a supportive and kind community.
Thank you, Rayanne. I encourage you all to watch this video. It's short and it's very catchy. And it might play whether we want it or not.
I was just going to say, it's going to come on. I don't know if we have time to show it. It's only 10
I don't think we do.
I don't think we do either.
Makes a difference to your future.
I will encourage you to go to our website. It's both on the CNPEA website and EAPO's website. You'll see it again under our projects page. It's right there, and you'll see that same front video. And our website is eapon.ca, and the Canadian network is cnpea.ca. We do have other upcoming webinars that we'd encourage you to join. Tomorrow we are doing a session with Ministry of Finance on the new benefits and credits for seniors for the new income tax year. That's in French. We also have 2 webinars for looking at financial issues of frauds and scams, because we are entering Fraud Awareness Month. And we also have another one on estate planning. And stay tuned, because we're also having a provincial conference on the 29th and some master classes on the 30th and 31st. So there'll be more released next week on that provincial conference. Here's our contact information. I know it's been in the chat boxes, but you can reach out to both Benedict and myself if you require further information or supports, and we'd be pleased to assist you. So thank you again for joining us today. We are so pleased that you're able to join us, and check out the website for the new listing for this webinar. It should be posted with the PowerPoint sometime tomorrow. Thank you for our speakers. Thank you to our ASL interpreters today. Great job, and thank you for joining us.